I'm here again today with Bonnie Specker, who is going to talk to us about R and what that means, and also give us an update on what's been going on nationally, locally, and in the state with COVID-19. Bonnie, what do you have for us today?
Well, I thought it would be a good time to actually talk about what the reproduction number R is and try to explain that to people. It is one of the thresholds that the city of Brookings looks at when trying to evaluate whether they want to go through different stages, up it or lower it. And I thought we would start by just showing this graph, and I'll get to a little bit in a few minutes, talk about what's on that graph. But what is this R that you often see when it comes to infectious diseases? Well, it's the average number of secondary illnesses or people that you make sick that one infected person would produce. So there's two different kinds of R's. We have this basic reproduction number, which people refer to that as R naught, and that indicates how infectious a disease is in a completely susceptible population where 100% of the population has never been exposed to this virus or is not immune to it. The effective reproductive number, and I'll call that for this presentation RT with the little t, is not limited to only a susceptible population, and it also takes into account some other things such as social distancing and adjusts for that. So if you have an R less than 1, each infection or each person that's infected will cause less than 1 new infection. And if that happens over a period of time, the disease occurrence will decline and eventually die out. If your R is equal to 1, I'm infected, I will cause 1 new infection. So I may get you infected, but just you. So I'm infected, I cause 1 infection. And if that happens, disease occurrence will remain pretty stable, but there's not going to be an outbreak. It's when you get R's of greater than 1 that you have a disease that the occurrence is increasing, or there may be an outbreak. And that's when each infection causes more than 1 additional infection. And we'll go back to that graph I had up in the beginning. And these are the actual R values for Brookings as of September 4th. September 4th is over here on the far right. And I just want to talk a little bit about these axes. The axis over here on the left, this is the R value. So this R of 1, we have this straight line going across so that we can easily see where the R value is relative to that line, because we want it below that line. This axis here is the incidence, or the number of cases. And if you look down here at the legend, what you see is the first one is R. So this solid brown line is what R is on any particular given day. The dashed lines are the confidence intervals around that R, because R is estimated from data, and there's variation in data, and that confidence interval gives you some measure of how certain you are about your estimate of the solid line. Whoop. Then we have the green line, which are the actual number of cases that were observed. And these are taken from the Department of Health website. So they're the dates that the cases were posted on the DOH dashboard. So you can see back here early in September, September's these last, since this is as of the 4th, these last section of this graph is in September. We had close to 40, maybe 40 cases on this particular day. But you can see what the R is doing. And back here in July, for quite a while, R was below 1. That's a good sign. You can see we didn't have a lot of cases around that time. So here we have R equals 1, where it crosses that solid line here. And then up here, we have an R of equal to 4. And I just wanted to show you illustratively or grammatically using pictures what that means. So here we have an R of 1. So this person's infected, they pass it on to one other person. That person then passes it on to one person. And you can see it's not going anywhere, but it's persisting. Here we have an R of 4. And this one person is now going to make 4 people sick, and those 4 people are each going to make another 4 people sick. And you can see how the number of cases increases rather dramatically very quickly. So we want to keep that R value as low as possible. Now here's what an R of 0 looks like. This is what we want, right? It's you have one infected person, but they don't give it to anyone. So it just ends for that person. The closer you can get R to 0, the sooner the outbreak will be controlled. And the World Health Organization actually states that you need an R value less than 1 for at least 2 weeks before you can say that the outbreak is controlled. So there is some guidance as to what it is you're striving for. And that's what we're striving for, is this R value less than 1. Things that can influence R, if you have a disease that is infectious, highly infectious, and can infect a lot of people, then that R value is going to be higher. Measles is one of the most infectious diseases out there. It has a very high initial R value, or R naught, because it's so infectious. It can spread to a lot of people really quickly. COVID also has a fairly high R value because it has a long infectious period. You can be infectious with COVID 1 to 3 days before symptoms develop. And then the first 7 days after symptoms begin, you're infectious. And that might even be longer if you have had a big exposure to the virus. The more people someone comes into contact with while they're infectious, the greater the number of people they can infect. And that's your definition of R, right? The more people you can infect, the bigger your R. So if you're around a lot of people, you can end up having a high R value. Behaviors that in society that can change the R value can do it by minimizing potential exposures to others. Just like if you have one person who's exposed to a lot of people and that can increase your R, if you're not exposed to people, you can reduce the R. You can do that by socially distancing. Wearing a mask is an excellent way of reducing that R. Increasing the number of immune people in a population also will decrease your R. So and the 2 ways you can do that is either through herd immunity, which we talked about last week and is not recommended for COVID, or through immunization, which is hopefully the way that we're going to be able to stop this pandemic in the future. That's it. I hope it helps people understand what the R is when they hear it being discussed when it comes to COVID. You have any questions, Chelsea?
Thanks, Bonnie, for giving us that update on R and what it means. It really helps to understand what we need to do moving forward to help reduce that number, and how something like COVID can actually spread so quickly, because as that R goes up, it spreads to more people.